This urgent health warning about a mystery illness for dogs is true. I'm Ariane, I'm a fact checker with Verify. Using these sources, here's what we can tell you about the illness that's spreading across the country. The American Veterinary Medical Association and multiple state veterinary associations have confirmed that there is an unknown respiratory illness that is spreading among dogs. Cases have been reported in Oregon, Colorado, New Hampshire, Massachusetts, and Rhode Island. Veterinarians say it starts off as a cough that can last a few weeks and then can progress into severe pneumonia. According to the Oregon Veterinary Medical Association, it doesn't usually respond to antibiotics or other medications. As for warnings about the illness being extremely fatal, David Needle, a senior veterinary pathologist at the University of New Hampshire, says,
very rarely is fatal, but usually is not.
Veterinarians say they haven't been able to figure out what's causing it. But to be safe, experts recommend avoiding dog parks and boarding your pet, and to make sure that your dog is up to date on its vaccine.
What exactly is it and how deadly is it, right? We don't want to freak people out, but how serious could this be?
So it appears that for the most part, the cases are more about a prolonged cough and respiratory disease that is longstanding and resistant to common treatments, and less about mortality. I think it's hard to feather out the fact that there are, like you said, seasonal upper respiratory diseases that occur in dogs, and there are dogs that get pneumonia and dogs that die, unfortunately, at all times. So separating out what's going on with that, it can be challenging. I think fear is not what should be motivating people, probably just being a little bit more conservative and concerned. Mm-hmm. And if you're in one of those states where there's a high incidence of this type of syndrome, that you should be a little more careful.
There are going to be people who are watching Errol and I right now who are planning on boarding their dogs for Thanksgiving. They're making their plans for December now. Should they be concerned about their dog's health if they're going to be in one of these situations?
I think if you're in a place where there's a higher incidence of the disease, that there's more risk for having more contact. We learned a lot about how to interact when there's a respiratory disease from what we went through in the last few years. So that's something worth considering. You know, you could get a house sitter or a dog walker or something like that.
Questions mounting for man's best friend after an unknown respiratory illness began affecting hundreds of dogs nationwide.
There was just far more coughing dogs coming into the emergency room than in years past.
While research is still underway, vets calling the illness highly contagious and in some cases fatal. Most reported symptoms are similar to those of a typical kennel cough, including coughing, sneezing, nasal and or eye discharge, and lethargy.
Instead of that dry cough where the dog felt good, it was now this wet cough where the dog felt sick.
Idaho dog owner Wendy Brown says her 3 golden retrievers, Bridge, Dooley, and Lulu, each started showing symptoms earlier this month.
Dooley started doing kind of this huffing and also seemed to feel quite lethargic. And not too long after, Bridge began to exhibit the symptoms.
At first, Brown thought it was just a typical kennel cough, but when the symptoms didn't go away, she knew it was something more.
Mystery illness in dogs going around, and we need to talk about it. Since April, the vet med industry has been managing a coughing dog illness, and it's been more rough than usual. These dogs are not testing positive for any of the common causes of respiratory illness that we see in dogs, but have the same clinical signs: coughing, sneezing, eye or nose discharge, and can be abnormally tired with poor appetites, hence where the confusion lies. Just like the other upper respiratory illnesses we see in dogs, most are likely to contract the infection by being in close contact with numerous other dogs in places like daycare, dog parks, groomers, or boarding kennels. What we have seen today is that this particular illness can progress in 3 different ways: a mild to moderate cough for 6 to 8 weeks or longer that doesn't respond to antibiotics or only responds a little, chronic pneumonia that doesn't respond to antibiotics, or severe pneumonia. Our advice is to avoid boarding dogs over the holidays if at all possible, and if you need to put your dog in such a situation, we recommend contacting your vet ahead of time for guidance and whether this is a good idea or not. And as always, we highly recommend keeping your dogs up to date on vaccines.
I'm Dr. Matthew Wheaton of Alicia Pet Care Center, and I'm here to talk to you about this new respiratory problem that we have emerging in dogs, actually across the entire country. This is a very interesting situation and obviously concerning as you see the headlines, and everybody's getting very nervous about this. We know very little about this, to be honest with you. There is a lot of information that is to be gained in the near future from people looking into the hows and whys and looking at the different organisms that are potentially being found in some of these dogs. But the bottom line is this, that we have a new respiratory problem that is infectious in nature, very likely. There is a possibility that this is a bacterial infection that is potentially a new bacteria that is maybe something that dogs have had for a while, but recently had some degree of either a mutation or some kind of virulence that happened to the actual strain of bug. Theoretically possible that it's a virus, but so far known viruses are coming up negative on the testing that is happening across the country. These dogs are becoming sick with upper respiratory symptoms. Typically it's cough, but could also be nasal discharge, sneezing, that kind of situation. Some of these dogs are quite sick, so some of them have presented with pneumonia. Some of them pneumonia dogs have actually died. So it is a possibility that this has severe impacts on individuals, but this is a spectrum disease most likely, where we have very, very mild cases. Probably the majority of them are going to be, treated as outpatients and not hospitalized, but there are going to be a small group of dogs potentially that have much bigger issues. Some of these dogs, in a worrisome way, have progressed really rapidly to their demise in a matter of potentially 2 days after illness symptoms started to show up. So it's very concerning, of course, as we certainly want to nip this in the bud, but it's very early on, and so we're in a situation where we don't really know what the organism is. We probably don't have immunity across the board because it's probably a new organism or a sort of new strain of an organism that there isn't immunity for, and we really are probably not going to have that knowledge for several months. We also are probably not going to have any preventatives, so there's not likely to be a vaccine that's, sort of magically appears. We're probably years away from a vaccination, if that's even something that is possible. So right now, I think the important thing is to be aware that this is a likely contagion, so it's likely going to happen from one dog to another. Those cases are typically coming out of high volume situations where you have a lot of dogs in a small indoor location typically. So boarding facilities, groomers, play groups, daycares, that type of thing. So those are the things that you want to really make sure that your need is high enough that it warrants embracing that potential negative consequence of your dog becoming sick. You also have the contagion issue in your environment. So if your dog gets sick, we definitely don't want to spread that. So it's really important to kind of keep that in mind. Kind of going back to just being conscientious about your decisions and understanding that there's consequences to those things, and really trying to set the world up, let's say your local environment, for not having this problem escalate into a much bigger issue. Veterinarians, again, have only so much space in an isolation ward, relatively small spaces in almost every animal hospital. So having multiple dogs come in that need to be isolated if they're having to be hospitalized is very problematic for us, because we just not going to have the cage space for management of those dogs. So trying to keep it sort of a flattened curve, that kind of thing, is also important. So again, if you don't really need to have your dog in one of those higher risk environments right now, it's probably best to avoid that. Life goes on, and so sometimes you need to actually do that. Some dogs need to be groomed every 6 weeks or else. Sometimes there's vacations that are planned that can't be canceled, so you're going along with your boarding plans. But keep those things in mind, that there's some risks, some inherent risks that you're embracing when you enter into these kind of situations. Symptoms of disease are typically respiratory, so coughing being the primary one. Sometimes it's difficulty breathing if we've already had that case escalate to a pneumonia. What we're really hoping for everybody to do is to go to your veterinarian for care when you notice those problems, and be making sure that you're communicating those things to your vet staff, so that we have your dog set up for the best scenario to minimize spread of disease while your dog is at the animal hospital. And time is of the essence with this. Obviously, if you start to notice that your dog is having coughing issues or respiratory problems, you want to act on those things as quickly as possible. Additionally, you want to try to allow for your veterinary team to do necessary testing here. Because we're dealing with an unknown situation and lots of questions, and also a situation with kennel cough where we have 12 different organisms that are out there that could also be going on at the same time, and maybe it's actually one of those issues. So ideally, when we have these cases coming in, we're able to do the testing that we want, which is generally a PCR test, which is a DNA test looking for those organisms, also doing a culture, looking for bacteria to grow, and then potentially x-rays of the chest to define whether or not there's pneumonia. Those are important steps for us to kind of track down what the actual offending organism is and be better off dealing with that problem. Again, treatment is important, so obviously you do the treatment that your vet recommends, ideally the best treatment so that we have the best outcome. This is a great time to get your pet insurance in order if you don't already have that. But the additional thing is really trying to make sure that you're trying to minimize additional exposure. So if your dog was exposed to a known issue, you want to try to quarantine that dog for 2 weeks. If your dog gets sick with this problem, we want to try to quarantine that dog for a month from the time that the treatment initiated. And these are broad categories that we potentially will change, but that's our initial recommendations at this point. Again, there's no magic bullet for what you can do to avoid getting sick. It's primarily to avoid other dogs that are potentially sick. And again, you may not know that the other dog is actually sick. So trying to really try to measure the need for those group activities and weigh those against the risk of getting sick. We will update you as more information comes out. This is a changing problem, an evolving problem that I am very confident that our veterinary community will get their heads around and have great recommendations for us to be able to help our patients long term. In the meantime, try to stay safe and try to advocate for your pet's health as much as possible through quick responses to these things. If you have questions, feel free to ask them from your vet team, and we will strive to continue to keep taking care of your babies. All right.